Welcome to the office.
Welcome back, Kostas.
Nice to meet you again.
Nice to meet you again. So, we've had a few visits.
We did.
How are we doing?
Very good results.
Let's talk about
very,
it.
very nice. Very nice.
Talk to me.
So, jaw is okay. I think it's clear now. Opens and closes.
That was one of the main reasons you came,
Yes.
was for your TMJ.
Evenly. Now
Okay.
the opens and closes very good. Very
Okay.
nice. The symptoms from the clavicle still popping, less. Symptoms lower from the clavicle, I have none.
Good.
Nothing.
Okay.
But everything is on the trap now.
Okay.
Okay. It
Okay.
was trap and chest. Now it's only trap.
Okay. So it's getting better. It's getting better here.
Yes, I think I have no symptoms or maybe very little.
And the popping and clicking
It's less, but it's still
there. And part of that is going to be rehab when you get back,
Okay.
right? Because you're going to retrain your ligaments.
Okay. Okay.
And a couple of the things, number one is going to be flossing for your shoulders. It's a video I have on the YouTube
Okay,
channel.
Okay.
Yeah. Planks.
Okay.
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 I know you love your planks.
Okay.
And then as you get better with your planks, which I know you already got the strength, you can put her on your back.
Okay.
Hold her up.
Nice.
Okay? So
Okay.
you get that resistance as well.
Okay.
Okay?
Okay.
You'll feel it. And then the other part of the plank is to, when you're in plank position, I'm obviously not on the floor, you're going to go down, you're going to do a little bit of serratus anterior. with
Protraction and retraction of the.
Correct.
Okay.
And a little bit of serratus. So you can even do with a 5-pound weight on your back,
Okay.
the boxing muscle, serratus anterior. You know it better than anybody. Okay, so we're going to do a little bit of serratus this way. You're going to do your reverse shoulders,
Okay.
Not-
So
right? 25 to 30, 3-4 times a day.
this gives me clicking, but it. Okay.
It's okay. Go forward with it,
Okay.
because you're going to get the movement. Then you're going to do some isometrics, and you
Okay.
want to do proprioception. Okay?
Okay.
What else? Scaption exercises, right?
Okay.
External rotators,
Okay.
internal rotators. 90 degrees, external rotators, internal rotators.
Okay.
Back in, 45 degrees, external rotators,
Okay.
right? You're going to hit all those different ones. Clavicle. I like, if we're using a band, okay, and we're doing shoulder flexion with bands.
Okay.
Cool? Then as you do that, you can do compound. And this, now we have to figure out how we're going to do it with a band. Maybe you'll know better. I want you to go up, back, and this.
Okay.
I'm going to show her. We're going to go shoulder flexion, we're going to pull back, and we're going to externally rotate. Go back, okay?
Okay.
And you're going to feel all in here when you do that. The last thing, you're going to do, you know how you take the dumbbell typically, and you're on your back, and you're bringing it overhead?
Okay. Dumbbell pullover, I think it's called.
Dumbbell pullover,
Okay.
with band though.
And the resistance comes from.
The band from the floor. Okay? So you're
Okay.
pulling over.
Okay. Okay.
And this, you're going to do more endurance training. Actually, with all of this.
Okay.
Endurance training means 4 sets, 25 reps. Last set to burnout of the exercise.
Okay.
Okay?
Okay.
Simple. Let's continue.
Okay. Most of those exercises I already did, but I had no from the left scapula control.
I'm going to work on that still.
Okay.
I'm saying when you go back, you're not doing it here.
Okay. Okay.
Okay. So jaw is better.
Jaw is excellent. It's fine.
Popping is a little bit less.
Like 50% less. A lot less.
I'm good with that. You've had it for how many years?
12 maybe.
Okay. Chest symptoms.
Chest is 80-85% better, I think.
Okay.
Maybe it's in my mind that I have symptoms. I don't know. Trap is the same though.
Okay. Back. How was this movement? Remember you were...
It's perfect. 100%.
Yeah?
Yes.
From our last visit?
Plus,
Damn, we didn't do a video.
plus it stayed.
Huh?
I've noticed that when we do an adjustment, I'm perfect here, but when I leave, it's still better, but not so much. The rotation stayed the same. It was perfect. Even today, if I tried, it's the same from one side to the other.
It is.
It's the same, yes.
Same meaning it's better, or it went back to what it was?
It's the same. It's each side. It's 100%.
Oh, they're even.
They're even. Yes, they're even.
Cool. Okay. All right.
Only leg is still different.
Discrepancy.
Yes, and it's more the discrepancy here than in the X-ray.
Go on your back. Over here, please.
Okay.
Face up. So, let's just rule out. Let's measure it,
Okay.
just to make sure that there's not the anatomical component.
Okay.
Lift up. Bend this knee, please. And let's measure. I'm looking for symmetry. Straighten it out, please. Bend a little bit and down. 20 and a half. 21 minus 1 is 20. Let's go this side.
From the right, it's short.
It's not the femur. 21 minus 1, 20. Okay. So then that means our focus now is the
Sacrum.
right pelvis, and we got to do them both. Sit up for me, please. Okay. Turn the meter on the back. You ready for me?
Of course.
Good. Starting at the base of the neck. Five points, C1. So the trap can be coming from different places.
Okay.
It can be coming from spinal accessory nerve, which is the atlas, C1, up here, upper cervical. It's actually cranial, spinal accessory nerve is cranial nerve number 11, but we can affect it through the upper cervical adjustment. It can be coming from down here, 5 points. It can be coming from the shoulder. It can be coming from the scap. We're going to check C1 and C6 up top. Actually, I have a better idea. That's only 1 point. And the other thing you want to work out is also your lower traps, right? Lower traps, when you work them out, lower trapezius, they pull the scapula back, less chance of shoulder injury and less pain, okay? All right. L5 is actually clear. Sacrum is clear. We're doing pelvis. Back slowly. Bottom of the joint, middle, top. And guess what? This is gonna be a fun one because I gotta do a PIIN. It's gone down and in, which I'd normally like to do a pull move. But because it's in the convexity, we're going to have to go involved side down for that adjustment. It's a special adjustment. Huh?
Spicy.
Not spicy. Not tart. You're going to learn today. 1, 2, 3, 4. It's not in the book. Tender?
Not so much.
Okay. Tender?
Not.
Okay. Then I'm staying in the parasympathetic nervous system, and you're going to tell me tomorrow how that did with the reflux. Okay?
Okay.
Fair enough? Sit
Yes.
back for me, please.
It's tender there though.
Not so bad here.
No, on the left.
All there. left. Okay, let's check it out. It's actually C2 that we have to work on. That's 1. That's 2.
Yes.
It's 2. C2 and right pelvis today, okay, sir?
Okay.
Let's do it. Can I have you walk it off a couple of times? I want to see the back of your walk. Let me open up the back here so we have something to compare to the first visit. Go ahead and walk to the corner of the room and back a couple of times. There's still that little tinkle, but the dimples are definitely moving up and down better.
I have better balance, I think.
What do you notice in him?
This.
Better balance? Okay. Okay, have a seat, let's get started. So today's game plan, C2, right pelvis. Check the TMJ, oh we didn't check the TMJ, he said it was perfect, let's see. Open. Well then I guess I'm gonna, so you want me to do the deviated septum adjustment or you want me to do it boxing style?
I prefer boxing style.
What's the hardest part of training to be a boxer? What's the hardest part?
The mental part.
Not the physical?
No.
You can run 30 miles, 50 Ks?
At some point you will be able to. First day 10 miles, second day maybe 20.
What's your record?
Of what?
How far have you?
I never did too many distance, too
Okay.
much.
So what was your main training then?
Like hit,
Big bag, speed.
everything, big bag, a small bag, a speed bag,
Mm-hmm.
jumping rope,
Mm.
technique, tactics,
Mm.
all this.
Cool.
Coordination maybe.
You know Muhammad Ali used to live over here, right? In this neighborhood.
I have
in
no
Hancock
idea.
Park.
No.
Yeah. He used to live in Hancock Park
Okay.
when I first moved here. Okay, let's go over here. You ready?
Yes.
Okay. Let's do C2 first. Okay, let's do C2 first. C2. And I gotta clear that muscle a little bit to get right on that bifid, right underneath there. And it's gonna be light. Make sure we don't lose it. If I go too far up an extension, guess what happens? We lose the contact and you rattle. Nice and easy there. Good. Good. There. Look up. Come on down.
Face or back?
Face down. Madam, can you help? We're going to do his scapula here.
From the legs.
Here. One
Oh,
here,
okay.
one here. Left hand behind your back, please.
Here.
Yes, sir. Lift up. There you go. Catch. Don't push. Deep breath in. All the way out. Gotcha. Okay. Now the PI involves side down push. Walk it out, sir. And let's go right side down now. I'm going to need to bring these down. Right there. So, PIIN, the contact is going to be there. Now, you see how I'm hunching over way too much? No bueno, guys. Let's get up on your shoulder. Let's hold here. Slide forward just a tiny bit. There you go. That's it. Now, let's roll him so I don't have to hurt my back. So PIIN, I'm on pisiform contact on the PSIS. And I got to bring it that way. Up and out. Let it roll. Let it roll. Gotcha. walk it out. Nice little conch. This. And walk it out. So. Let's go face down over there, please. I want you to raise your whole left leg up as high as you can. No pain with that, correct?
No.
Raise it up again as high as you can. Good. And down. Raise your right leg up as high as you can.
Higher.
But it shouldn't be. If it's PI, it should be harder. Raise it up again.
Left or right?
Left, please. And down. Raise it up again, please. Left. Pretty cool, huh? Left side again. Right side again. Oh, come on. Walk it out, sir. That was pretty cool, huh? And now look at the dimples in his back. A little bit better. Okay, sir, back over here, please. I just want to check the movement of the pelvis now. So when we're doing motion palpation or static palpation in the Gonstead work, it's static. PI, if it's down, is going to be more tender on the top. If it's AS, it'll be more tender on the bottom. EX, the whole thing will be tender. IN, it's usually in the front, which we can't actually palpate. Motion palpation, I'm on the top of the joint, coming back slowly towards me. Middle of the joint and bottom of the joint. Left side, top of the joint, middle of the joint, and bottom of the joint. A little bit right there.
Maybe.
Maybe. Now, I'm down low. Okay. Sharp?
Not sharp, no, not at all.
Sharp?
No.
Cool. Let's re-scope, make sure everything is clear. Sweet. Starting at the base. Doo-doo. C2 is clear. T2, T3 showed up. Sit up straight, dude. Let's try that again. Maybe it's the posture. Never mind, it's the posture. So when you're slouching, you get pressure here.
Okay.
When you're sitting straight, there's no pressure. All clear. Cool. Now let's check that. Ears, shoulders, and the nose. Over here on your back. On your back like this. There's no adjustment.
No.
Snoring's not coming from there now. As you get your curve fixed, as you work on the curve, that little reverse up top, and we've been working on it through the adjustment too, it will get better. We'll use the wedge in the meantime.
And the towel.
Yes. Okay. All right, you're all set, dude. Stand, check it out.
Check what?
Duty. I don't hear. Give me a second. Go face down over here.
Face down here.
Yes, sir. Bespoke Chiropractic. Custom tailored for you. Yes?
Yes. Not so much.
Bring it out. Let's work on the posterior tib. Bring it back a little bit. Now the fun part. Don't kick me, dude.
I will try.
Traction. I got a traction, open up the joint. There's the lateral capsule and meniscus. So I'm working the bulge that's created from the misalignment of the tibia here. 4, 3, give it to me, dude, come on. There. Almost, come on. Yeah! There. Bend the knee. You gotta give it to me, sir. Hold on to the table in the front, please. On top. Slide down a little bit. There. There you go. On your back.
Sorry, I'm still not sure about that.
On your back. Your back. Little more. Bend the knee. Relax it. There. Stand up and walk it out. And then let's retest. What?
It was painful.
Have a seat. Mira.
I think it's better.
Bring it together. What do you think? Look on top, please, Shasha. Looks different to me. Can you look? Tell me.
I think it's the same.
It's even.
It's even.
Yeah.
Can I do my testing?
Sure, do it. Halas.
No idea. I cannot see up here.
Oh, why don't you come over here, Shasha? All right. So in that position,
It's always worse, I think.
this one's a little forward.
Yes.
Now sit. Do it again.
Here is the
They're
same.
even. All right. I'm going to let you guys figure out what you think it is. And we're going to talk about it tomorrow's visit, okay?
Okay.
Sound good? So in this position, seated, weight bearing, he's fine. Non-weight bearing, so weight bearing, he's even. Non-weight bearing on your back. This is non-weight bearing. Go on your back, please, and bring it up. But also remember, dude, you're not sitting the same. So if we look here, we got to even this first. This is not even. So let's even that first.
Okay.
And then let's see. First, let's make this even. So make sure your heels are even so this comes there. Good. Now why don't we look up top there? Look up top over there. Okay. Bring the knees together. Don't give me your middle finger, bro. Relax your head back. Good. So there's still a slight discrepancy there. And we're gonna need to figure out why is that. So anyone have any ideas? Let us know. Let's see what you guys think. Okay, you're all set for today. Squeeze. Squeeze.